Welcome to Health Talk by Flowly. We begin every episode with a brief exercise to shift your nervous system closer to flow state. We do this so your nervous system can settle, and you'll feel relaxed and ready to experience the interviews in each episode. Julian, who is the voice of our Flowly experiences, will take a few seconds to lead this exercise.
Take a moment to adjust yourself into a comfortable position. Take a slow breath in through your nose, hold it for a few seconds, and slowly exhale through your nose as well. In your next breath, breathe in for a count of 5. 1, 2, 3, 4, 5. And now exhale for a count of 5. 1, 2, 3, 4, 5. Continue to take slow breaths in through your nose and out through your nose as well, counting in 5 and counting out 5. We have you breathe in this pattern because it equals 6 breaths per minute, which is the average breathing rate at which people can best control their nervous system. In Flowly, we do individualized calibration to find the exact breathing rate healthiest for you, because it varies from person to person. For today, we'll end this exercise with one more 5 count in, 1, 2, 3, 4, 5, and a 5 count out, 1, 2, 3, 4, 5. Let's begin today's health talk.
Hey y'all, my name is Celine and I'm the founder of Flowly and your host for Health Talk by Flowly. As many of you know, Flowly is a mobile platform for chronic pain and anxiety. And essentially we teach users how to control their breathing and their heart rate to better manage their nervous system. We use something called biofeedback for relaxation training and virtual reality so that you can do it while fully immersed in basically another world. But we also started this podcast and this interview series because we wanted a way to connect other members of the chronic pain, illness, mental health community with each other, as well as bring in health advocates, health patients, and professionals in the space to really share their own ideas, their own tips, journeys, and lessons they've learned along the way in their invisible illness journey. As we all know, everyone is so different, so we want to bring in as much perspective and different experiences as possible. And so I'm really looking forward to today's chat with Kirsten Soong. Kirsten has worked in the public sector as a leader in grassroots organizing for Planned Parenthood and ACLU. And she was recently at Google, where she led the multinational strategy for Google Maps and cloud products. Not only is Kirsten now an MBA candidate at Harvard Business School, but she herself is a chronic pain warrior. And I wanted to interview Kirsten because she brings not just her own professional experience in the public sector to the table, but also her own learnings in experiencing managed chronic pain. So without further ado, welcome, Kirsten.
Thank you so much for having me.
And you're coming all the way from, are you in Cambridge, Boston right now?
I am, yes, in Cambridge right now, yes.
Cool. So I wanted to start at the beginning of sort of your diagnosis journey. And I do that a lot as a first question with our patient advocates and patient warriors, because it's been a few years since you started experiencing your chronic pain or the symptoms around it. And as we all know, the diagnosis journey can be really challenging, to say the least, for many people, and especially for women in the health journey. And so I wanted to know, what was your journey with that? And did you have any particular challenges you faced along the way?
So my journey started about 7 years ago, and it is probably the most difficult thing I've ever had to deal with. It started basically with just some pain that I started just getting some flare-ups. And so I decided to see my primary care doctor. Slowly, the pain actually started getting worse and worse and worse over time. And that doctor connected me with an orthopedic doctor that, had a 3-month wait. So I'm still suffering through kind of all of this time. And then that doctor didn't think I needed surgery at the time, but we tested a bunch of pretty painful processes, different injections, a bunch of different processes. That didn't seem to work. So then I was kind of in this scary place where I didn't really know what to do next. I was trying physical therapy and different things. And so I was just basically talking trial and error, talking to different people, all while being in a ton of pain. And I remember being told that there was this top doctor in Palo Alto that was the best that I could see. And so I was in a ton of pain. It was raining. I was on the brink of crying. I was just in so much pain. But I drove down from San Francisco. And that doctor actually only was a specialist in one vertebrae of the spine. And so I didn't know that. And so he saw me and said, I can't really examine you or help you. But, from what you're saying, it sounds like either this is in your head or it's something that you'll probably have to deal with the rest of your life. And, especially being in that place of it has a medical background. I don't, and I'm in tons of pain. I remember just going to my car and just hysterically crying, just not knowing, is this really going to be the best I'm ever going to feel for my life? And I don't really know how to navigate this journey. I remember just being so scared. And then I actually had to take some time off work and decided after a small accident to defer a year from Harvard and spend about a year and a half just fully dedicated to getting better. Through that, I probably met around 40 plus doctors, but was able to meet some incredible people that helped support me through my journey. And I think, remembering if you're out there and you're feeling pain, that there are people that will provide you hope. And that it reminded me to the importance of being an advocate for yourself and trusting your gut when you meet particular practitioners. I was in a really scary place 5 years ago. And today, I don't have pain. So, that's a pretty incredible and grateful place to be right now.
And I know you're saying that you met over 40 plus doctors and, you really find, I think for most of the people that we've spoken to and a lot of users will say that a lot of times they will encounter very negative practitioners or practitioners that don't believe them when they go into the room and they talk about their own symptoms. I know we've talked about this before where you found a lot of hope with some practitioners and maybe just people in your life that have created a community for you. So what was that process of being able to create that community around you that provided hope and support in that time?
Yeah, I think that it was definitely really difficult when I, explaining, for example, the experience in Palo Alto, and I had a lot of different doctor experiences, but I was grateful for them because it made me realize to be my own advocate and to trust my gut. Even though, you may not be trained in the medical field, your body. And when you meet with someone, just because, they have one opinion, if you don't feel like that makes sense for yourself and for your body, that you don't have to, they're not the be all end all. And you should continue your journey of finding new people. For me, it was a lot of trial and error, but it's kind of like friends. Like once you find one amazing person, for me, that was a physical therapist who helped find me a really great physiatrist. And then a lot of times those people know really amazing other people and can refer you to kind of this team. So that's what happened to me was I have two doctors that are actually some of my closest friends now. I would see them like a few times a week. I think that trusting your gut is I think the number one piece of advice. I think secondly, being selective in just this whole general process of being able to have hope and support through this. Not everyone understands necessarily what you're going through. And I'm generally a person that shares a lot about, what I'm dealing with and what I'm going through, whether that be family members or friends. There are just certain people that when I had conversations, it was much more challenging and difficult for me, especially starting at, for example, Harvard and meeting hundreds of new people. I didn't necessarily want to explain my whole entire story of like every single detail of what I was going through. So it actually helped me a lot was spending some time and just writing down and practicing like a canned response of, this is what I'm going through. This is what I feel comfortable sharing. And that actually helped me a lot to feel supported and not feeling like I can share with people what I wanted to, and then being selective in who I actually wanted to kind of go deeper and explaining in detail what I was going through. So that really helped me feel hopeful and supported through my journey.
I think that's an amazing piece of advice, the idea of writing down first and then maybe creating a response that you could use, especially when you're meeting new people or more unfamiliar people, because I do think that we underestimate how vulnerable health is to each of us. And in fact, I struggle to think of something as vulnerable as your own identity, as so much is tied to your own health and how you experience it and perceive it. And I think that's something that we've heard a little bit of from a lot of the patients that we work with. Is it's frustrating, like needing to explain yourself. First of all, every time you meet a new practitioner or like you're going into a new clinical setting, and then much less like talking about, going to family events or going to social settings, like needing to explain why you might have to sit down every hour, you can't dance at the wedding, or, just little things. And I think that's something that I'm definitely going to take to heart and share that advice, because that's really, really interesting and helpful. But I think one thing is, and I always want to be very cautious of balancing like the positive with the negative, because there's no way we're going to go around the big challenge of being a chronic illness, chronic pain patient. But at the same time, I think there are some techniques and tools that we can have in our toolbox for how we manage the roller coaster of emotions, physically and mentally. And I know you had said to me that for you, recovery a lot of time feels like, one step forward or two steps forward, one step back. So how do you manage the times when you do feel you're one step back? And then maybe also, how do you manage when you're two steps forward too? Because that can be, it can be learning to manage that on both sides.
Yeah, absolutely. I feel like it's kind of both in my pain journey and just in life. I think this idea of kind of two steps forward, one step back has helped me a lot. It was actually one of my doctors who I would see quite often when I had flare-ups, when it just basically that phrase just kind of changed my life. And, I'd come into his office, basically almost crying on the table. And when you're in that much pain and you're in a flare-up, it's all consuming. It's very scary. And my doctor would always remind me, and he would say, like, remember, Kirsten, two steps forward, one step back. And for me, that meant look back at like where you were 6 months ago. 6 months ago at that time, potentially, like I couldn't, every day I had a flare up. And then at that point, I was having a flare up every 2 weeks or so. Recovery, around pain and just mostly, anything, whether it be something you're going through, you can't really expect to take one pill or one surgery and get better. Like it's a zigzag. It's a reminder to look at the bigger picture, that you are getting better. And that you've also, when you're in a flare up of pain, remembering that you've been there before, that you've been in a pain flare up and you've come out the other side. And those reminders during those pain moments were really, really helpful for me. Mm-hmm. Knowing that for me, especially as you mentioned, it's an invisible disease. And in the beginning, it was really scary for me because it felt like I was the only person having this. I wasn't going to get better. And learning from my doctors and meeting many other people by sharing my story, that there are so many people that have been in your situation and they have gotten to a place of no pain. And yeah, just remembering everything takes time. So
yeah. And I wanted to introduce to add on to that is, because I know a lot of people listening do currently still have pain. And, one of the questions we always get is, how do I emotionally and mentally manage that, where I feel like, okay, this is never ending. And what one user we had recently spoken to, she has chronic pain, and she was saying that through Flowly, she learned this, but I think you can learn this in different, with different PTs or therapists and different tools, is that a lot of times prior to Slowly, she would think about her pain like it's a permanent thing. Like every day I'm going to be feeling this flare up. And in of itself, it felt discouraging, right? But then I think what she slowly learned was that when she was going into flare up, she would remember, wait, this is temporary. And that I have done this before. Like yesterday I conquered it. Today I'm going to conquer it. And there is the end of this tunnel, basically. And I think that was a big sort of light bulb moment for her, even though it sounds so simple, but I'm sure you can probably relate where it's not so simple in the moment to actually recall that. But once you're able to, it's a great tool to have and way of thinking about it when you do experience it. The other big thing for us is we're always trying to equip ourselves, right? Like this is one example. But we want to equip ourselves physically, mentally, maybe even socially with how to manage an invisible illness or disease. So what traditional or alternative tools do you have or have you had in your toolbox to manage on a daily basis?
Yeah, that's a good question. So my answer to give like a caveat is that, I have been working on this for 7 years, and I did take a year and a half to just focus on my health. So there are a lot of different things that I personally do, but I think that every single person's body is different. And so it's really important to trial and error and figure out what is really best for you. And to remember that I think we're taught a lot, as I mentioned before, with anything medical related, that, you just need to figure out what that surgery is or what that pill is or whatever it is, that physical therapist, and that you'll be better. And it's important to remember with pain that it's not just one thing that is necessarily going to help you. It's really important to come at it from many different angles, because you have the physical aspect, and then you also have the brain kind of mental aspect, because without your brain telling you to have pain, you wouldn't be feeling that pain. But it's something that to also be grateful for, because it's telling you that it's potentially something wrong that you need to be paying attention to. For me, it's a combination of, number one, if you're experiencing a lot of pain and you're experiencing flare-ups, people will tell you a lot of advice of all these different things to do. But number one, I think, is figuring out what will help you during that flare-up. Because if you're crying in pain and you can't do anything, someone telling you like eat better or like sleep better isn't necessarily going to help you at that moment. So for me, I had an incredible acupuncturist, PT, and massage therapist that when I had an extremely bad flare-up, before, trying to potentially go to the hospital or something like that, really helped me. And I knew also if I had something stressful coming up or I had travel coming up, I always scheduled a lot of appointments around that time, just in case, to make myself mentally feel comfortable about, whatever situation I was going in. And then I think once you figure out, okay, what are the steps that I can take in order to be better, just for the flare-ups, it's important to look holistically about how to fully be healthy. And I think that that's something that I'm really grateful for this experience, is that, realizing how important my health is, and that without my health, I have, nothing else. And so I found it actually really lucky at a young age, or any age, to realize how can I actually live my best life. So things like, I do actually think sleep is extremely important. I have a sleep tracker. I have my blackout curtains, making sure the bed that you're sleeping on is like a good bed, because you spend 8 hours every single day of your life on it. I have a sleep therapist. I think meditation and Slowly is incredible and has made a really big difference for me as well. So it's honestly figuring out and experimenting what is a routine, and also, what is your way of life currently? What is your job? I mean, for me, I changed my entire career, and I changed my lifestyle just because I knew that it wasn't supporting my health. And I think that that wasn't just like a decision I made in a day, but it was something that I realized that I needed to change. So
one of the things, this kind of leads into my next question, which is inspired by a Flow user who I was speaking to. And I think oftentimes you'll hear kind of like general advice because when you're a pain patient, or even if you're like a mental health or anxiety patient, you try a lot of different things, right? And you hear a lot of different advice. So this question is being asked from the perspective of understanding each person is individual, each person's experience is going to be different. However, I think it's really interesting and helpful for others to hear more about the nitty gritty. So like, what is and we can take today, like, what is your daily routine? And like, from the moment you wake up in the morning, what time do you go to bed? What time do you wake up? Are there particular habits that you feel are pretty important to you every day that does help you get through each day?
And I think it really is important to not judge yourself, because for me right now, I don't have too much pain. For me, every day, and even not too long ago, when I was in school, I had a bit more flare-ups. So I think it depends on when you wake up every day, how you're feeling, and how you respond. So for example, if I wake up and I'm in a ton of pain, I'll make it a priority to see like an acupuncturist or someone to do body work. So I have my Fitbit or whatever tracker that you want to use. And I try to get at least 8 hours of sleep a day. Then I wake up, meditate. So I use something like Flowly to start my day. And then I shower. I also do about 30 minutes of stretching. I've probably had about 10 PTs or more. So through that, I've figured out the stretches that actually work best for me. I actually have a recommendation for working with PTs, if you guys are, or if you're working with a trainer, is to ask them to video you or them doing the exercises, because that was a huge game changer for me. You're in the office or you're at the gym or wherever you're trying to learn this exercise, and you think you're going to remember every little detail. Like, make sure to keep your hips this particular way, or else this could be bad for you. And having a video of that, now, for example, I've been trying to do I've been feeling a lot better. So I'm adding some more exercises into my regimen. And I have like 80 videos that I'm like, I want to add these back in. So I can go back to my arsenal, rewatch the videos.
Great tip. Yeah.
So that's been helpful. I think exercise is important. And then also just remembering that, like, for me, and for everyone, pain is a part of me, but it's definitely not, it doesn't define me. It is not my entire life. So I do create like a daily to-do list, a weekly to-do list, a monthly to-do list. And that helps me keep my track for me, to make sure I'm doing the things and I'm being an advocate for myself, for my health, and I'm making sure to make those things a priority. But I'm also, working on the other things in my life, or seeing friends, or doing whatever I want to do that makes me happy and makes me feel fulfilled.
Well, I think that's what you said, that it's part of you, pain, but it doesn't define you, is so important. And that kind of leads into my next question, which is, what are you looking forward to right now in your future? Any projects, plans, things that you're taking on already, or you're looking to take on in the future?
So I think that actually this whole experience has changed my whole career. And I actually want to work specifically in helping people with chronic pain. And I think what makes it difficult is the fact that what you said, it's an invisible disease, but so many people are suffering through it. I'm also so grateful. I think every person I've spoken to that has had chronic pain has said that they are grateful for the experience, and that it actually has made them a better person. For me, it's made me be an advocate for myself, not only for my pain journey, but for any health experience that I ever have in my future.
Right.
It helps me see a bigger picture, also my problems. There was a time, in my life where every day I just wished that I could wake up without pain. And now I do. I wake up and I don't have pain. And to look at the problems in my life and realizing just to be grateful for so much of what I have. We have this short life to live. And it really has helped me reflect on, what do I really want to do with my life? And especially everything going on in this world, there's a lot of challenges that we're seeing and facing. So, I'm excited and grateful for this pain journey, the people that it's brought to me, the lessons that it's taught me, and that, I hope that if you're in the middle of this challenge or experiencing pain, that I hope you know that it's actually a great lesson and tool, and everyone has something, like everyone has things that they're going through and challenges that they're going through. And for me, this was the challenge, but it really can change your life for the better.
I think it's amazing that you have that perspective, and that you've been able to reflect back on that experience and help you essentially. I have to say, working with this population of people, which is 100 million Americans, so that's a lot of people. I think what my team and I have discovered is that really invisible illness patients are some of the most empathetic people that we've met, very strong and resilient. And so I completely echo what you're saying. And I think that's a really beautiful note to end our conversation on. So I really want to thank you for sharing this, Kirsten. I know this is one of the first times you have shared your story, but I think people will really appreciate and resonate. So thank you for being here.
Yes, no problem. And thank you for, working on Flowly. I really, Flowly and meditation and really working on your brain, I think really makes a big difference. I think that healthcare in general is a human right. And I think that I felt really lucky to be able to have a year to focus on my health. I feel like it was a really big privilege to be able to have that time and space to focus on my health. And I know that not everyone has had that opportunity. And especially with everything going on with COVID, that people tell us since I was a little girl, like, without your health, you have nothing. And I think with COVID, that really has kind of made our world realize that it stops trade, it stops our economy, kind of have shut down our whole world. Even things around the protesting for, equality, for women's rights, all these things all tie into calling an end to the conditions that have created that inequality. And I think a big part of that is universal health care and access to healthcare. And I think it's a human right to have healthcare, but also to live a life without pain. And for me, I felt like my life was taken away because I couldn't live my life. And I understand, why people, have to take painkillers or do different things in order to live their lives because they can't find a current alternative. And that's why I'm really grateful for you, Celine, and for Flowly for creating, you're not just helping people, you're really helping to save lives by giving people access to something that can be a part of their journey and help them with their chronic pain and help them get their lives back. So thank you and your team so much for what you're working on. And I'm really grateful to have met you and had this opportunity to speak with you.
Thank you. Well, I'll just say we're a very small piece of that puzzle, but I think our mentality is if we can even be, like 5 minutes in your day of feeling good and feeling comfortable and feeling relaxed, I think that's a big step forward for a lot of people. So just 5 minutes is fine for us. All right. Thank you so much, Kirsten. Thank you everyone for listening in and look forward to our next episode.